All right, good afternoon. I'm going to go ahead and get started. Again, my name is Calvin Smith, and I'm here today to talk to you about Meditap. Now, Meditap is a startup health information technology company derived from a number of research projects that we implemented at UAMS Northwest. Now, for those of you that don't know, UAMS Northwest is a relatively new satellite campus of UAMS here in Little Rock that we're doing a number of great things in the advancement and education in the healthcare environment. Now, what we were looking to accomplish with these number of projects and what we're looking to accomplish with Meditap is to provide a tool for healthcare professionals to implement the patient-centered medical home concept. Now, one of the key features that we see with this patient-centered medical home concept is, I'm sorry, you can't hear me in the back? Okay, I'm sorry. One of the key features that we see as a need in this patient-centered medical home concept is the need to shift the focus point of patient information and patient care from the large medical centers to where the patients actually spend the majority of their time. Now, this is the primary care and family practice clinics. Now, there are a few key factors that are restricting this change. One is obviously the lack of primary care physicians and primary care healthcare professionals in general. A recent study by UAMS shows that there's a shortage of over 10,000 healthcare professionals in Arkansas alone, and that's going to continue to grow as more and more baby boomers continue to retire, and continue to serve a growing population. Now, another key problem, one we're really focusing on with Meditap, is incomplete and unavailable patient information. Now, this is caused by current health information technology systems that are being implemented being very disparate and unable to communicate with one another. So a provider that's using health information technology really isn't getting much more benefit than he would have if he was still using a paper-based health record system. And he's unable to show meaningful use of this health information technology. Now, this meaningful use is significant, as many of you probably know. In order for healthcare providers to receive incentives from the federal government, they need to show meaningful use of their health information technology based on a series of milestones. And in 2015, if they're unable to show this meaningful use, they're going to start getting penalized on their Medicaid and Medicare reimbursements. So what all these problems really contribute to is really more administrative redundancies. We've observed in our clinics in Northwest Arkansas that health information technology is actually causing our providers to spend 20 minutes more per patient as they adopt these technologies than they would otherwise. And so really there's a reluctance in the healthcare community to implement a lot of this health information technology. So this is what we're looking to accomplish with Meditap, and hopefully it'll be a solution to these problems. So what is Meditap? Meditap is a common graphical user interface based on the iPad and the iPhone. And what we're looking to provide, again, is a common tool that healthcare providers can use to see more patients in less time while also improving the quality of care that they provide. Now, we do this by implementing a couple of key technologies that we believe are at the future of the healthcare technology world. The first is the LifeCom DARE system. This is a technology from Oregon's Health and Science University that is a clinical decision support system. And what it does, it takes a vast medical knowledge library and input from patient information and history, and it combines those to complete a running differential diagnosis. Now, early tests that we've completed here and in Oregon shows that a CNA using this system can 92% of the time, just by itself, 92% of the time can get the same exact diagnosis as a trained physician would just by using the system. Now, there are some key problems with this system. As you can see from some of the screenshots of LifeCom in its current state, it's very in-depth and it's very hard to use. It's not real user-friendly. So that's one of the key problems. Another key problem is it doesn't communicate information with existing health record systems. So it really adds, even though it's a great tool and adds value, it really adds to the administrative redundancies that healthcare providers have because they're having to input information into LifeCom and then again into their health record systems. So we're actually able to solve this problem in the Meditap solution by implementing UnityWare's CEMR technology. Now, what this is a very unique interfacing engine that allows us to go into any medical care setting and integrate the Meditap solution into and exchange patient information with any existing electronic health record system, whether it's a billing system, and regardless of the vendor, version, or location. And here's a few screenshots again of the LifeCom system when it has more patient information inputted. So another key, trend in healthcare right now is the switch over to cloud-based health record systems, and we're actually able to implement a number of these systems directly into the interface of Meditap, so that you don't have to have two different interfaces. You can use your cloud-based health record system within the Meditap interface and still get the value add of connecting to these other systems and the decision support tool. So another key piece that we found that by doing this, by connecting this Meditap solution with the decision support system along with these electronic health record systems, whether they're legacy-based or cloud-based, we actually create a health information exchange network. And I'll explain more about this in just a second. So what is the Meditap business model? Again, our focus is on primary care and family practice clinics. You see there's a few of those here in Little Rock. So since we are focusing on these clinics and some of them are small, we look to keep implementation costs low to keep adoption rates high. So we're going to be operating on a subscription-based model of about $175 per month. Now this includes the provider and what we like to call his patient care team. It is the physician, the CNA, the LPN, RN, if they have an APN, includes that entire care team with that $175 per month. And so, again, we are focusing on family practice clinics, but what if the hospitals need something like this? Well, again, we are a certified reseller of the UnityWare CMR technology, which is targeted towards hospitals. And we can actually go in and implement this UnityWare technology into the hospital, which usually starts for about $300,000, and then we can connect all the systems within the hospital. And many of you may know that UAMS is in the process of looking for something like this right now. So how do these work together? So again, if we go into, say, Arkansas Children's and we connect their internal systems with UnityWare, and then we have Meditap that has connected all these external clinics through the Meditap solution, we can then integrate that information together. So the information that's gathered at Children's Hospital can be passed on and back and forth between the clinics through Meditap, and then as we add more Meditap subscribers, that health information exchange network continues to grow. So what you really have is a virtual clinic of patient information sitting out there, and it creates more value for the end users. So who are some of the competitors in this market? As you can see here, this says over 300, I think it's now over 380 electronic health record systems are currently out there in the market today. Some big names, IBM, GE, Microsoft, are all would-be competitors that are in the electronic health record market. There are some more mobile-based ones, NextGen, Dr. Chrono, Be Nimble, but do keep in mind, even though there are these large competitors out there, we can go in, we can integrate with their systems. You don't have to replace them. You can use our solution, add value to what you're doing, interact with the patient more, and you can keep the investment you have in any of these systems. So the primary care physician market is currently over 240,000 primary care physicians in the country. Just the health IT market in the primary care sector is projected to be over $10 billion by 2015, and this is mostly projected in the mobile area. So what is our marketing strategy? Well, since we are partnered as not only a testing partner but also an equity holder as UAMS Northwest, we do look to start this market rollout in Arkansas, build off of our AHEC clinics, and then expand within the state, and then later on regionally. And obviously, down the road, once we have a fine-tuned product, we'll look to expand nationally. So what are some of the financial pro formas built around this? Well, as you can see, we are operating off a subscription-based model. It takes time to build that model. So the first year, we're starting low at maybe 27 annual subscribers, though you do see a revenue there of about $600,000. Keep in mind, again, we are a reseller of UnityWare's technology, which is technology available today that we can go out and sell. And we're in the process of testing that in Northwest Arkansas. And so as we add the annual subscribers and the revenue increases from that, hopefully by year 5, based on our conversion rates and the sales market we look to have about 9,000 annual subscribers at a revenue of about $19 million. So what are we looking for? Right now we are looking for about $50,000 to finish product development. We also need another $100,000 to finish testing at UAMS Northwest. We have 2 clinics that are signed up that have already tested part of this product, and so we want to implement the full piece once product development is completed. Later on down the road, once we have a product ready to go and we have a market established here in Arkansas, we do look for another investment of about $300,000 to do a national expansion with. So, with that $50,000 to $150,000 investment, you can look for about a 37x return on your investment, and that's based on a 1.5 times 50-year revenue. And we do look to be acquired by some of these larger entities that I mentioned earlier, or some entities such as Google that may look to get into the healthcare sector. So who is the Meditap team? Again, my name is Calvin Smith. I'm the Director of Business Development at UAMS Northwest. We do have a strong board of advisors that's helping further along this development. Dr. Pete Kohler, who's the Vice Chancellor, many of you may know him, spent 20 years as the President of Oregon's Health and Science University. Keith Fott is a CPA who has many years in clinical experience in the healthcare sector. Steve Brooks and Jeff Amrine are hiding in the back there. They're both strong advisors for us, and Dr. John James, who is a sort of a local rock star, is a MD turned e-commerce entrepreneur. He's also an advisor of ours. So that's the short of it. I'm gonna be here for today and tomorrow. I'd love to talk to you more about Meditap, what we're doing there, or UAMS Northwest in general. And thank you for your time.